Good afternoon and welcome to the 2022 Family Needs Assessment Briefing webinar. My name is Sarah Morrison. I use she, her pronouns, and I am one of the co-chairs of Building Bright Futures Families and Communities Committee. I am a mom of two boys, 6 and almost 4, and I live in Lamoille County.
Thank you, Sarah. My name is Jen Fortman. I co-chair BBF's Families and Communities Committee alongside Sarah, and also sit on another BBF committee and am the family lead on a federal grant that is funding this project that I'll discuss a little later in this presentation. I'm a mom of a 6-year-old son and 4-year-old daughter, and I live in Hyde Park.
Thank you all for attending. We're excited to have over 100 people register for today. As a note, we are recording this presentation, and the link and a copy of these slides will be shared in a follow-up email to everyone who has registered. On our agenda for today, we are going to tell you a little bit about our committee and where we fit within the BBF structure. We're going to give you an overview of the 2022 Family Needs Assessment, its design, implementation, and analysis. We're then going to highlight our findings in detailing the limitations of the survey process, respondent demographics, and outlining the related findings that led to the policy considerations at the heart of this briefing. We're pleased to welcome a panel of partners to discuss the policy considerations and how they fit into their work. And finally, we'll open up the discussion to a question and answer session with our remaining time. Questions can be placed in the chat at any time throughout the webinar. The Families and Communities Committee is one of 7 Vermont Early Childhood Action Plan, or VCAP committees under the umbrella of Building Bright Futures. The VCAP committees work toward 4 goals, and our committee is focused on goal number 2, that families and communities play a leading role in children's well-being. Our committee is made up of majority parents and caregivers who are compensated for their time and work, working alongside public and private partners. Highlighting caregiver voices helps us create an early childhood system that mirrors the diverse needs of families. We partner in bigger picture conversations about improving the early childhood system and decision-making processes. Our committee provides a safe and welcoming place for families to bring forward thoughts and concerns. As parents, our children come first, and interruptions are expected and welcomed during meetings. And in that same vein, Jen and I both have our younger children home with us today and apologize in advance for any interruptions. I'd now like to introduce Morgan Crossman, the Executive Director of BBF, to tell us a little about BBF structure.
Thank you so much, Sarah and Jen. I am so proud to be here today alongside our Families and Communities co-chairs and the entire committee. So just want to say thank you to the 2 of you on behalf of the entire BBF network and to that committee, because the work that's gone into designing and implementing and executing the Family Needs Assessment has been so impressive. And your committee infrastructure and this body of work and data is going to play such a critical role in really helping our legislators and Vermont partners across the board understand the key challenges that families are facing, as well as communities, and how to think about moving that work forward. So today I just want to say a couple of things about the BBF network. And first, that Building Bright Futures is Vermont's early childhood public-private partnership that's charged under Title 33, Chapter 46, as Vermont's Early Childhood State Advisory Council, which is the primary mechanism used to advise Vermont's governor and the legislature on the well-being of children and families. We are also charged with maintaining and monitoring the vision and strategic plan for the early childhood system, which is called the Vermont Early Childhood Action Plan. The visual you're seeing on the screen is a representation of our 450+ person network, where all of our work is all about supporting children and families and using evidence and data to inform decision-making. At the base of our network, we have 12 regional councils that are supporting 7 strategic plan committees, and the State Advisory Council, which is meeting on a monthly basis. So this network is such a robust opportunity to understand the needs of kids and families, and our Families and Communities Committee is one of those committees that plays such a critical role in ensuring that we are elevating family and community voice and making sure that families are playing an active leading role in providing feedback and input on the early childhood system and being partners in implementing and advising to make sure that our system and our supports are working well for them. today's early childhood family needs assessment presentation is not just a tool that will help inform early childhood stakeholders and policymakers to consider as they're developing and implementing policy, but it's also such an important testament to the importance and the power of a project that's driven by family leaders. It also speaks to the incredible work that families can produce as partners when they are supported and compensated for their time. So, under both the Vermont integration project, VIP3 grant, and our new work under Vermont's preschool development grant, I'm really excited to see what is in store and what we can accomplish by partnering with families and really empowering them to play a leadership role in strengthening Vermont's early childhood system. So just another deep gratitude and thank you to Jen and Sarah, as well as our Families and Communities Committee for this incredible body of work and such a strong report. So I'll hand things back over to Jen, who's going to talk more about the family needs assessment.
Thank you so much, Morgan, and to everyone at BBF for providing this opportunity for family leaders to have a voice in the early childhood decision-making process. The creation and implementation of this 2022 Family Needs Assessment was led by myself, Sarah, and the members of the Families and Communities Committee, and supported by BBF's State Advisory Council, along with other organizations from Vermont's early childhood system. This work was funded by the Health Resources and Services Administration through the Vermont Integration Prenatal to Age 3 VIP3 grant. This 5-year grant ending in July 2026 is led by Vermont's Department of Health, Family and Child Health Division, and is partnering with BBF to support building upon and strengthening system integration, family leadership work, and an equity lens within Vermont's early childhood system. This survey was designed throughout the spring and summer of 2022 with the intention of being able to conduct the same survey regularly in order to be able to compare and help identify strengths and challenges families face throughout the state of Vermont. Once the survey creation was completed, 14 parent ambassadors were recruited from around the state and trained remotely to share the survey and collect responses between August 15th and October 15th, 2022. The survey was promoted on social media, hanging flyers with QR code links to the SurveyMonkey in popular community spaces, delivering paper copies of the survey to harder to reach communities, and more. Most responses were submitted electronically through SurveyMonkey, though the paper version was made available for circumstances in which it was preferable or required for those without access to broadband internet or devices. All responses to the survey were anonymous. Parent ambassadors were supported by Sarah and I throughout the duration of this project. Once the survey was closed, all parent ambassadors that were hired for this project, along with families who completed the survey, were invited to join the Families and Communities Committee in hopes to keep connecting with those families from around the state. Over the next 6 months, the data team at BBF analyzed and summarized the quantitative or number-oriented data and statistics, as well as the qualitative or testimonials and personal experiences of respondents from the survey. They found 7 reoccurring themes from the individual responses to inform policy and decision-making in Vermont's early childhood system. With collaboration between BBF and community partners, this resulted in 4 policy considerations. I would now like to introduce Nicole D'Agostino, BBF's Policy and Program Manager, who will review the limitations and demographics of the survey along with some quantitative data.
Thank you, Jen. So first, we're going to go over the limitations of the survey and the analysis. So when we're looking at the survey itself, we do see some self-selection bias. So respondents were more likely to already be connected to the resources in the early childhood system, given the survey was administered by parent ambassadors, their network, and social media. The vast majority of respondents also participated in the survey via SurveyMonkey Online, which required a reliable internet connection. In terms of accessibility limitations, the survey was long, around 7 pages, so people filling out the survey needed to have the time to fill it out to its completion, and the survey was primarily in English, so a good grasp of the English language was also necessary. Some services were also not specifically asked about, such as mental health services or home visiting services. We also had a limited ability to fully analyze a large volume of data, specifically qualitative data. We received a lot of comments and concerns about services and supports in Vermont from the 600 plus responses we got to the survey. So we weren't able to analyze all of them, but we feel like we did a very comprehensive job analyzing the data that we had. There was also a limited sample size in some counties. So a few counties had less than 20 responses. So it was difficult to tease out trends from such a low level of responses. Because the survey was done in early 2022, there were some limitations related to the COVID-19 pandemic that may not apply to situations today. Next slide, please. Oh, there we go. So looking at the data itself, there was a total of 639 responses representing 1,089 children in Vermont. This is representative of about 2% of Vermont's total child population under the age of 9. And if you look at the pie chart to the left of the screen, you can see that the age most represented for children was age 3 at 14% of children. Next slide, please. Looking at responses by county, it's no surprise that we see Chittenden as representative of the most responses, given that's the most populous county. But we also saw some surprises as well from counties such as Orleans County or Bennington County that don't have such a high population. And this was due to the incredible work of our parent ambassadors at getting the word out about this survey and making sure that it got filled out by parents of those locations. Next slide, please. So when we take a look at race, ethnicity, and gender, we can see that the majority of our respondents identified as female at 83%. This was followed by male respondents at 14%, and those who identified as another gender or preferred not to answer at 3%, or 19 respondents. The majority of our respondents also identified as white at about 88%, followed by 2 or more races and Asian. And we can see at the bottom that we needed to suppress some data due to confidentiality reasons, particularly for American Indian or Alaska Native respondents and Native Hawaiian and other Pacific Islander respondents. About 7.5% of our respondents identified as Hispanic or Latino. Next slide, please. So getting into the meat of our responses, the vast majority of our respondents agreed that they had access to basic physiological needs. 92% of respondents agreed they had access to safe, secure, affordable housing. 94% agreed they had access to reliable transportation. 91% agreed they had access to affordable food that met their needs and preferences, while 92% agreed that they had access to and could afford the necessities they need. However, when we broke out this data by non-white or multiracial respondents compared to white respondents, we saw the percent of agreeing with these statements was vastly different. So for example, when we're looking at the statement, my family has access to and can afford the necessities that we need, white respondents agreed at a much higher rate, 94%, than non-white or multiracial respondents at 78%. And this was a very similar story with affordable food that meets some needs and preferences. We also see a difference in those who are participating in 3 squares versus those who are not. So family having access to affordable food, we can see those participating in 3 squares were less likely to agree to this statement. And you'll be able to see when we take a look at the policy recommendations later on in these slides, you'll be able to see how this data influenced a lot of information in those policy recommendations. Now I'll hand it back to Jen and Sarah to continue going over data. Thank you.
Thank you so much, Nicole. At the beginning of our survey, we asked respondents to rate their overall experience with 7 services or and supports on this Likert or sliding scale. The responses ranged from 71% positive in childcare early learning settings to 93% positive in medical care settings. We then offered respondents 3 opportunities to provide in-depth feedback about those services and supports, answering more specific questions about their experience and offering an opportunity to write in any comments. Here we see a range of numbers in the number of responses from 257 people focused on Head Start and early Head Start services up to 606 people focused on medical care services.
From those in-depth responses, 7 key themes emerged across the services and supports from both the qualitative and quantitative responses. Of note, although respondents had different experiences with services and supports, and these themes were not universally experienced. Positive themes that emerged include relationships with providers, communication, and ease of access. When commenting on relationships, respondents used words like friendly, welcoming, exceptional, supportive, knowledgeable, and caring. Respondents particularly appreciated quick response times, providers who listened carefully, and providers who reached out to check in. Closely tied to relationships, communication was highlighted as a key contributor to positive experiences. Effective communication strategies noted by respondents included clear and concise guidance, multiple options to communicate, and spending time together to establish a common understanding between providers and families. Ease of access is both a positive and challenging theme that emerged from the data. In particular, availability of timely services and geographical proximity were highlighted or insinuated when respondents were describing a positive experience. This leads us into the 4 challenging themes that emerged: difficulty navigating the complex early childhood system, difficulty accessing a service or support due to cost or inequity, kindergarten transitions, and difficulty accessing a support due to availability. Vermont's early childhood system is complex and often difficult to navigate. Knowing where to go for information, understanding what services and supports were available, difficulties with paperwork and communication, and services having different eligibility requirements were common responses. Cost or inequity of access were also noted as key barriers families faced. This could be the inaccessible cost of childcare or basic needs such as food, diapers, formula, etc. While there are free and low-cost services and supports available and financial assistance for some families, the income and eligibility is often different between services and can be hard to understand. Responses in regard to kindergarten transitions showed mixed experiences. Families highlighted concerns such as limited visitation prior to starting, unclear daily routines, lack of connection with classmate families, and limited information shared from the schools. COVID restrictions were likely a cause for some transition concerns. However, there is currently no universal guidance on best practices or expectations. Availability was highlighted as a key barrier to access. This could be due to geographical distance, limited or no openings, long wait lists, or services that were a mismatch with the respondents' needs and desires. Of note, although mental health services were not one of the 7 service and supports specifically identified in the survey, it was frequently highlighted by respondents and in meeting discussions of the Families and Communities Committee.
From those 7 key themes Sarah just mentioned, 4 policy considerations were developed. The first policy consideration is to elevate and align Vermont's strategies to inform and connect families to resources. 14% of respondents didn't know where to look or who to ask when looking to access a new resource. 13% of respondents were not able to access needed services, resources, or supports for their child or children and family. A quote from one family in Windham County: "There are so many different ways that services are offered, and it is not always clear how they are related. Word of mouth is a primary way that I learn about services and supports, but that is limited to my circles. Various directories are confusing and can provide conflicting information. A bunch of resources are also far away." Another caregiver in Orleans County felt like information on various services is so scattered that it's hard to find and access everything that's available. Policy consideration number 2 is to review national best practices to reduce administrative burden and promote equity of access to necessities, such as food, diapers, formula, etc. Only 6% of respondents indicated that they did not have access to, nor could they afford the necessities they needed, whereas 22% of non-white or multiracial respondents indicated that they did not have access to, nor could afford the necessities they needed. This is a huge disparity that we hope to better understand and seek to address in partnership with early childhood stakeholders. A quote from one family in Caledonia County states, "Not being from here originally, I had no idea what systems were in place. Each system, such as WIC, food stamps, Medicaid, etc., have different financial eligibility requirements, and it's incredibly confusing. For a long time, I didn't even know I was eligible for financial assistance for our healthcare because I assumed it was the same as food stamps."
Policy consideration number 3, support the implementation of clear guidance on the full scope of kindergarten transitions. 20% of respondents felt the transition from pre-K to kindergarten did not go smoothly or their needs were not met. 23% felt unsupported or didn't know where to go for information or questions. Kindergarten is a large transition for families because many are coming from center or home-based childcare or pre-K programs, and this is their first experience with the school. For some families, the process was unclear and caused anxiety for the child and family. A quote from one family in Franklin County, "My child will start kindergarten next week. The meet and greet with her teacher was incredibly brief and really lacked in terms of introducing us to the school system. I am not at all comfortable with sending my child to the school and am not confident that she will be kept safe. I do believe that in the end, she will be safe and school will be great, but I wish that the teachers and staff made this clear to help with the anxiety of sending your child off to school." And policy consideration number 4, pursue integration of mental health services throughout Vermont's early childhood system that encourages ease of access for families with young children. Availability of services was a barrier mentioned by respondents across many services and supports. This ranged from childcare to food shelves to medical settings, difficulty due to geographical location, limited open hours, or long wait lists. While our survey did not specifically ask about mental health services, the theme emerged from respondents of the survey in many Vermont counties. This has been mirrored in many of our Families and Communities Committee meetings, as well as other BBF Council meetings. Quotes from families specifically highlight things such as long delays between receiving referrals and hearing from providers, long wait lists for both child and family counseling, and trouble finding providers. A quote from one family in Chittenden County, "It has not been easy for my child and I to get mental health counseling. Both my child and I were waitlisted at least 15 plus different counseling centers or private counselors, and we remained without therapy for over 2 years until we both finally got in at separate places." I'd now like to hand it over to Anna Brulette, Building Bright Futures Policy and Program Director, to lead us through the policy considerations again and introduce our panelists.
Thanks so much, Sarah. As Sarah and Jen just shared, these are the 4 policy considerations that resulted from the findings from the Family Needs Assessment and conversations with the Families and Communities Committee. These considerations can be read in full in the report and are intended to be further considered by partners across the BBF network and Vermont's early childhood system. The Families and Communities Committee will play a role in monitoring progress related to these considerations for policy, and will have the opportunity to advocate that they be included in the annual policy recommendations endorsed by the State Advisory Council in the coming months. So I'm now going to turn us towards a panel of public and private partners who hold significant expertise and experience related to the focus area of these policy considerations. Each of these partners also played a role and lent their expertise to the BBF and Families and Communities Committee teams when we were drafting these policy considerations as well. So I'm going to pull down the screen share, but very soon I'm going to ask each of our panelists whose names are here on the screen to introduce themselves, and I'll ask you all to do so in the order on the slide. So first we will have Keely, and then Emily, Laurel, and finally Becca introduce themselves.
Thank you so much, Anna. Hi, everybody. My name is Keely Agan. I use she, her pronouns, and I'm the Early Childhood Nutrition Manager at Hunger Free Vermont.
Hi, everyone. My name is Emily Smith. I'm the Program Evaluator for Family and Child Health, formerly Maternal and Child Health.
Hello, I'm Laurel Omland. I also use she, her pronouns, and I'm the Director of the Child, Adolescent, and Family Unit at the Vermont Department of Mental Health. Great to be with you all.
And I'm Becca Webb, and I'm a Universal Preschool Coordinator. I work with 72 UPK programs and 10 school districts.
Wonderful. Thank you all again for joining us. I'm going to kick us off by asking you all to reflect a little bit on how these policy considerations fit into the larger landscape from your perspective, given the seat that each of you holds. And Becca, I wonder if you want to kick us off with this question.
Yeah, so I love this question. And I think when we're thinking about like the larger landscape, there's not one unified way that children are registered for universal preschool or kindergarten throughout the state. So what each district is requires for registration is different. So that has a huge impact on how that entrance and enrollment occurs for families. I think the other piece for the considerations and for us to understand in this conversation are really that the switch from early childhood programs, home centers, school-based, into the kindergarten system in the pre-K to 12 is a complete system switch, and that has some of these pieces. And then finally, like the piece around new families coming in at the same time that public school systems are completing testing, are completing their kindergarten celebrations, and just understanding that the piece is a two-way street, right? So enrolling new families at the same time of ending that really critical kindergarten year.
I guess I'll play off that a little bit and just say, you know, it's what we're talking about is transitions. And I think from a mental health lens, the acknowledgement that transitions take care and attention for the adults who are going through it, as well as for the kids. And so when I think about that from kind of where I sit in the mental health lens, it really is about how do we all have a role in acknowledging, supporting, you know, outwardly addressing that transition, because I think that's part of how we can have mental health and wellness. Because if we can talk about it, I'm a parent, I went through that transition from childcare to kindergarten and experienced all those similar kind of like, I have no idea, where's the information? How do I find this? And I think it's really important that we can raise that up, and then how do we talk together as a system and bring that parent lens as well as the expertise lens, if that's where you sit, about how do we support those transitions effectively for all types of kids and families, and how do we support the educators, just like you were saying, Becca, because of what they're also managing, to be able to make that time and to slow it down and recognize that these are folks who haven't been here. They haven't been through this walk. So how do we support that best? I'll stop there.
Laura and Becca, I'll just add something to that. And I think one of the themes across is this breaking down of silos, so that there is ease of communication, ease of access, ease of information sharing, not only to support the children and families who are going through these types of transitions, but also to support the improvement of the systems and services and programs that they're accessing and they need. So those silos exist across multiple levels, I think, within our society, that are just constant barriers to the progress that I think we're all here and really passionate about making. So moving towards systems that facilitate information sharing, data sharing, so that we can make really informed decisions at the higher levels to really help that same process happen at the family and community level.
Yeah, and compounding all of that too is this lack of access to basic needs, and knowing that, you know, regardless of how we can support the system and this need to support educators and the transition, that if children are showing up hungry or not showing up at all because they don't have access to food or housing and all of these other basic needs that are all compounding each other and affecting each other, they're not showing up ready to learn. And knowing that there is this inequity in access to basic needs and sharing that, based on a recent study, we know that, and this is during COVID, outside of COVID, exacerbated by COVID, that households with children in Vermont during this survey were 2 times more likely to be facing food insecurity, hunger, and other lack of access to basic needs than households without children in the state. And also knowing that people of color were at 4 times greater odds. Again, this is not stuff that's surprising to us. It just really just confirms that with lack of basic needs, lack of access to basic needs, and early educators not having the support and the ability, you know, when families are looking for information, we try really hard to empower early educators to have outreach materials about 3 Squares Vermont or other food access resources on hand because they're a trusted resource in that community, right? But when we're talking about the supports that early educators have compared to the K-12 system,
Did Keely freeze for folks? My other panelists? Okay. Hopefully she comes back to us, but really a critical point she was making and that everyone else just made. So I am going to move us along to the next question, which I think will pivot us to talking a little bit more about kind of the tactical or practical pieces of all of these policy considerations. And I see Keely rejoining. And so I'm going to ask you to kind of reflect a little bit on what actually moving forward with these policy considerations look like. What does progress look like? What does successful implementation look like? How do we think about improving quality and working towards a continuous quality improvement space in each of the areas of these policy considerations that they're highlighting? So I'll ask someone to kick us off, kind of thinking about tactically how do we move forward on the important policy considerations that the Families and Communities Committee has highlighted here.
I can jump in around the mental health, the 4th recommendation. And it did tie it to the Mental Health Integration Council and the recommendations that came out in the interim report. The final report will be due, I think, next January. And I've been a part of that council and the pediatric subgroup specifically. I think there's a lot of energy around wanting to make sure that we are thinking about how do we integrate mental health in the settings where children and families are, because that helps with access. And how do we do that effectively, right? And that can happen in many different models. You know, it can be about embedding someone with a mental health expertise in those settings, and we have different structures where we do that. School mental health being one example of those. Another is where we have a mental health clinician within a pediatric practice. But there can also be other efforts around building up the capacity and competency of people who are the leaders in those settings. So early childcare, early learning and childcare settings, for example, if there was some mental health consultation available to them and really helping think through, and this does exist, so I shouldn't say it as ifs, when there's mental health consultation available to early care and learning providers, that can help them feel more confident about how are they responding to the behavioral issues that they might be seeing in those different classrooms at the different developmental ages. And just thinking through, how do we apply early MTSS? How do we think about, are these needs above and beyond what that typical approach might be able to support? And when do we need to seek some additional expertise around that? And I think that's really what it's about. I'll just say, you know, I wish that we had a more robust workforce right now. It really has been significantly impacted by the pandemic, but it was also not fully where we needed it to be before the pandemic also. And I think there's a recognition that we may not ever fully grow the workforce that we truly need to address it. And so how do we address it through other parts of our system, and getting the right level of support so that when a child might have I don't want to say more lower level, but a certain level of need, that can be responded to effectively by the primary care provider, the early care and learning provider, the school, and maybe with a little bit of that extra support, as I said, from a mental health expert. And then having those pathways where when there is a higher level of need, how can we get that in a more timely way? And is the timeliness that I think is the biggest concern right now. Telehealth, I think, is a way that is helping with more rapid access and more availability, but there still is a gap within that. We also have a couple of initiatives around consultation programming for, I don't want to get too into the weeds of the model. It's under this AIMS framework, but where there can be a team with a social worker and a psychiatrist who can provide consultation to primary care providers around patients that they're working with where they have questions. And because we know access to child psychiatry is also really limited, not just in Vermont, but across the country. And so there are some federal initiatives to really bring some funds to states to build these up. So we do have that for children and pediatricians or primary care providers working with children and families. And we also have it for the perinatal population to be able to have their primary care or their OBs be able to access a psychiatrist to consult and get some information. So those are some different ways that we're trying to address access and workforce. There also are initiatives that have been underway to help both stabilize workforce, help with recruitment efforts within our public mental health system, because that's also been an area that has been significantly impacted. I feel like I've maybe strayed a little from the initial question, but wanted to try to get some of those in there. And if I can just say one last comment, which is a lot of the themes that I think came through in this report really tick the boxes of the Strengthening Families framework. And I think that is a framework that our different departments under the Agency of Human Services really do hold true to. And I think these recommendations are following that. And so I just want to say I really appreciate that aspect of it also. Thanks.
Go ahead, Becca. Sorry.
Oh, go ahead, Emily.
I can speak a little bit to policy recommendation number 1 in response to this question. And I just want to highlight that several of the mechanisms that were mentioned early on in the presentation, so notably VIP 3 and VIP birth to 5, the preschool development grant, working on the language transition there. But so these grants have facilitated work at the state level in partnership with our community networks and organizations that are asking some really hard questions. So we're taking really critical looks at our programs, our relationships, our networks, trying to figure out what's working. And if something is working, then how can we make it sustainable? And the other hard question is what isn't working? And then really getting down to the why of it and using really carefully selected methodology for evaluating that why things might not be working the way we want them to, or the way that our communities and families need them to. So really doing deep dives and figuring out what are national best practices, who's doing it right, while also balancing this uniqueness that is our state and the people that reside in our state and what their unique needs are, and how to marry those two in a way that can help us move forward in actionable and measurable ways. So like I said, just looking at our individual programs and services and find out how, assess their impacts for families and communities, but also aligning our continuous quality improvement efforts across not only our programs, but also our organizations and our partner networks, so that collectively we are incrementally moving towards a shared vision, a shared goal, a shared outcome. And that kind of goes back to my original statement in response to the first question of breaking down those silos little by little and making sure that we are making targeted change in the same direction for a shared purpose. And so at the Division of Family and Child Health, we're taking this approach in the domain of evaluation, through the lens of equity. We are approaching these things from a social ecological systems perspective, right? Breaking things down and looking at individual family units, how those units fit into communities, how those communities are within their regional culture and environment, and then, how those are all mirrored at the state level. So really taking it back so far into like these baseline perspectives and then building back up to facilitate our vision with tried and true methods, and also being really creative in our methodology for continuous quality improvement and evaluation of our programs. And I think this work is so timely, not only having a proverbial reset button coming out of the pandemic in a certain way, but also at the national level, we're seeing a huge push towards system integration across a variety of sectors. So with that said, I think the support that is available at the national level and at the local level is monumental and really echoes the calls to action that we're hearing in work like this, in the family needs assessment, and from our local families and communities. So I think all that to say is, at least at the state level within my own sector, we are really approaching this strategically, leveraging our strategic partners, their knowledge, their wealth of information, their relationships to improve our programming to help our families and communities, and moving that forward collectively with a vision.
I'm just sitting here like listening to all of this, and I'm like, wow, these are all such powerful statements. In really reflecting on the kindergarten transition piece of it, I really think we've reached this point where from a public school perspective, superintendents and school boards are really starting to get the message that early ed is important. It's a critical piece, right? And that messaging is coming from a variety of folks, but really raising the knowledge level is the first kind of action plan that I see. And then I start thinking about the fact that many supervisory unions across the state have recently switched or are currently switching their models because of this understanding, and hiring early ed coordinators whose goal is really to think about early ed provision, all of those pieces around, good early ed placements and proximity, and also who are available to help support this transition, because it takes people power, right, to do what we do. And then I think about the possibilities that come with funding. So early childhood special ed has transition processes, has identified and set statewide pieces of how we transition children from their early ed environments into the kindergarten environments. And so with the additional funding, with the additional support that the PDG grant gives, there's the possibility of creating, right, guidance documents and strategies and templates, and really having a conversation more on that state cohesive level of how do we do this in a really organized flow and way that's supportive versus regulations.
And sorry for my dramatic exit earlier. My Zoom crashed. Hopefully it doesn't this time. I'm going to keep my camera off just to be sensitive. But yeah, and obviously I can speak with talking about policy recommendation number 2 and talking about basic needs. I can speak mostly to food access. And I'll say Similarly to my colleagues here, we're doing a lot of kind of multi-pronged approaches to meeting families' needs. And a big part of it is identifying, obviously, fixing some of the childcare capacity troubles in the state, but also talking about providing meals in childcare. We know that at the time of our most recent survey, 22% of registered childcare programs in our state were providing meals through the Child and Adult Care Food Program. And that's versus 100% of public schools in our K-12 schools in our state providing meals through the National School Lunch Program. We also know that regardless of the many barriers to the Child and Adult Care Food Program, it is the most equitable way that we can provide meals in childcare settings, because we know that when families aren't having to provide meals for their children, and when that responsibility and that burden doesn't fall on them, their child has access to breakfast, lunch, snacks with nutrition guidelines. And so that child is able to access all the nutrition versus putting that burden back on the families. And so Becca actually and the Farm to Early Childhood Coalition, we did a focus group study, and many of you may have seen the report where we asked childcare programs, what are the barriers to being able to provide meals in early childhood settings? And I'm sure many of you, I'm preaching to the choir here, know what a lot of those barriers are. And so we are working with that data and the CACFP mapping tool that came out of the Farm to Early Childhood Study Coalition as well, to figure out how we can not only work at the state level to ensure that there is funding for nutrition and food access in the child care legislation that's moving forward right now, but also that we're utilizing technical assistance. We're working with early educators to make sure that they know how to direct families to food access resources and how to have those conversations. And to also work at the regional level to figure out what shared services are out there, how we can connect childcare programs to food access resources and families who are not covered by childcare as well. We're also working at the federal level with federal advocacy, things like the child nutrition reauthorization, which fingers crossed comes up at some point, and making sure our delegation is signing on to marker bills. So there are all of these ways that we are working at the state and federal level to make the connection for families, for food access, for housing, for transportation. We have the regional hunger councils that are also having these same conversations. It's not just about food access, it's about where they can get food when they're in a hotel or another temporary housing situation. And so again, it's all of these things having to come together and de-silo to make sure that not only are families getting access to quality early education, support in transitioning into kindergarten, but they also have access to those basic needs as well.
Thank you all. You've done a beautiful job kind of highlighting how interconnected all of these policy considerations are and highlighting the ways in which they each fit into your work. So I'm going to ask with just a couple of minutes left if you all have final thoughts that you want to share. And in particular, since this is a family-led project, would love to hear from you if there's any kind of ways in which Vermont families can get involved in the work you do, or ways you would suggest that they have their voices heard, or if there's just specific resources that you want to call out. Now is a great time as well.
I'll hop in again. We are often looking for families to be on some different boards or committees to give voice around the mental health system and what the needs are. I don't know if I can post in the chat, but I can put a link in there. We have some different committees related to, we have a state children's program standing committee, which really does directly inform the Department of Mental Health and the systems work that we do. There are also local program standing committees with each designated mental health agency. They would be glad to have folks, parents, guardians who have children who've needed to access the mental health system and want to be able to give some input to it. And then we have another council that really oversees our federal funded mental health block grants. I know there's a block grant within Family and Child Health and also the Division of Substance Use. So we often are looking for people with experience within the system wanting to give voice to that. So thank you for that consideration. And I think just our continued connection with Building Bright Futures and this group is another way that we can continue to hear input around that. So thanks.
I think for me, it's the recognition of all of this hard work and coordination, and really harnessing the information that we gained from this process, that the Families and Communities group went through. I think for my role specifically, it was really encouraging to find that our regional family surveys and answers, while not the same questions, really lined up in themes to the work of this group. And so one of the things that I'm going to take on personally, kind of moving out of this, is really looking more towards the recommendations that are coming out of the Family and Communities group into our work in terms of designing those systems, those feedback loops within the region that I work with.
I'll highlight a body of work that we're currently working on right now that is of service to families, and that is our Help Me Grow network, which is connected to 211. And the Help Me Grow network exists to help families connect, to be aware of resources in their area, to navigate the early childhood system, services, programs, and even get information on financial eligibility requirements. And we're currently heavily engaged with some CQI work around Help Me Grow and the role that it plays at the state level, and how it can be a resource not only to families, but also to our robust network of partners and providers to help better connect families to the much needed services. So we are, one, elevating that does exist, and two, always welcome feedback from our partner organizations, from families who have access services through Help Me Grow to better improve that experience, and to make sure that we are holding families in this time and space where we know there is such a need for additional services and providers. The need is not met with the number that we currently have in the state. So how do we hold those families in the interim while we can get them connected to services? And we're hoping that Help Me Grow can fill that space. But the more people know about it and the more families access it, the better data we'll have, and the better improvements we can implement around that. But I just want to highlight again that this is what is the information that's being presented here is so important to the choices that we make, how we implement our programs, and how we make them better. So just a huge thank you to all of the families who participated in this survey, and the data that we have here. It's so rich and so helpful for us to see. So, open door policy at FCH, anyone and everyone willing to give feedback on any type of experience, please contact me. If you don't know who else to contact, I will make sure it gets into the right hands. But our website is always great, and then our contact information that I'm sure will be shared out via this webinar is a great way to reach me.
And thank you all. In the interest of time, I'll keep it brief. I want to echo just what all of the other panelists have shared about how incredible this report is. And thank you so much for you all and the families who are able to coordinate this report and get this data out there. And I'll say that I'm happy to share kind of the tools that I mentioned regarding how we are surveying the early childhood field on food access and equity. And so that is the Providing Meals in Early Childhood Settings report, and the CACFP mapping tool can both be found on our website. And we really, if you're not sick of hearing about universal school meals, get ready for universal meals in early childhood. Obviously, there's a lot of stuff that we have to put in place in order to make that campaign happen, but we recognize how integral access to nutrition in childcare is for quality care and family well-being. And we're working with, like I've mentioned before, early childhood educators and childcare providers on making sure that they recognize that they are the champions of sharing information about basic needs and access to food and housing and transportation. But there's a lot of support that they need as well. And we are going to continue trying to collect that information from families as well. So looking forward to working with you all. Always feel free to reach out to us with any questions you have. And follow up. Thank you.
Thanks so much, Kaylee, and thank you to all of you so much for your time and with sharing your expertise with us today. We really appreciate it. I'm going to ask Jen and Sarah to pop back on with me, and we're going to, with just a couple of minutes left, answer any questions that participants have today. But first, I'm going to start by just asking Jen and Sarah to reflect a little bit on your experiencing partnering on and really leading this project. And if you can share if there was one kind of particularly powerful part of the work for you all.
Sure, thank you for this question. I think the most powerful part of this work for me has been seeing through kind of this entire project from beginning to end. I originally became connected with Building Bright Futures through a similar family engagement assessment a few years ago. And being able to use my experience through that project as a parent ambassador and bring it into this family needs assessment project and kind of becoming the co-chair of the Families and Communities Committee has just been very empowering. And also hiring and supporting parent ambassadors for this project is it was just such special work for me personally, seeing the connections that were made between parents and then between parents and providers. And just witnessing that and being able to support families kind of stepping forward and sharing their stories and experiences and just being vulnerable in the setting that we have in the Families and Communities Committee just makes all of this work worth it.
Yeah, I'll echo exactly what Jen said. I originally became involved with this committee in the exact same way as a parent ambassador on that 2020 survey that Building Bright Futures had put out. So I'll echo the same things. It was really wonderful to be engaged with this process from start to finish, writing this survey brand new, really focusing on it as a forward-thinking survey that we would hopefully be able to put out year after year or every few years, depending, but just to get consistent data and track trends and really understand and learn from the communities around us. The most powerful part, I'm going to have to say, is all of the quotes that we received from families. Being on this committee sometimes, and just being in friend groups, sometimes it feels like a feedback loop. You're just talking with your friends about the frustrations that you have, and it sounds like they have the same ones, and a lot of you live in the same area, so your frustrations are about the same places. So it can be really empowering and make me feel more connected, learning that these are concerns that are shared by people statewide, and it's not a localized problem to me. You know, it's terrible that the problem is statewide, but at the same time, it's really nice to hear that you're not alone in these problems and these concerns, and having this committee as a place to bring forward those problems and concerns. And it can often be hard to figure out where to bring that. So yeah, the whole process has been really amazing.
Awesome. Thank you both. I'm not seeing any other questions, and we happen to also be out of time. So Jen, I wonder if you want to wrap us up and tell folks how to get in touch with you in case they have questions after the fact.
Yes, so thank you all so much for attending. And if you find yourself coming up with a question later, please feel free to reach out to myself or Sarah. We will add our emails in the chat, and our emails are open. Feel free to contact us at any time with any questions or comments. And we appreciate everyone taking the time to be with us today.
Yes, thank you so much. You can also reach us on our webpage at the Building Bright Futures website, which is the Families and Communities Committee part of that page. Our information is all included on there, as well as information about our next committee meetings. We meet twice a month. And you can fill out a membership information form, or you're welcome to join us on those committee meetings anytime. We welcome any new voices, any new faces. So thank you so much for spending the last hour with us. We hope you have a great rest of your day.